try to provide a brief sort of bird's eye view of the situation in Germany, where I'm based, with regards to collecting data, the fuel essentially for AI for health, and to provide this kind of a look at what is the current state and what are the upcoming or immediate future prospects. Spoiler, current state is probably the state of maturity is not that optimized, but the prospects are brilliant. So I will try to go real brief through each of these points, the introduction and a few words about the recent legislative amendments that are supposed to make data available in the health system, including the following applications, and then the most recent, actually, the current legislative proposal. And I will close with the concluding remarks. Here you have the QR code of my LinkedIn profile. I'd be happy to be connected with all of you. To set the stage, Germany is the world's third largest healthcare market after US and China, basically approximately the same size as Japan's. Health, Germany spent 474 billion euros on health in 2022, which is already around or a little bit above 13% of GDP. Historically, it used to be 11 and a half, let's say, a few years ago. Germany is a multi-payer insurance system where 74 million or 88% of the population are covered by the statutory health insurance funds, and the remaining 10% roughly with private insurance. Some figures here, the number of hospitals, physician practices, and so forth. Until recently, Germany had one of the lowest levels of digitalization of healthcare in Europe. In one study published in 2018, Germany's digital health index score was second lowest among 17 countries at 30 compared to 70 at NHS England, 71 in Spain, and 72 in Denmark and Israel, and 82 in Estonia. However, in 2019-2021, the situation began changing, with the previous cabinet passing 28 laws in 3 years with some relation to digital health, including 6 laws fully devoted to digitalization of the health system. And the current cabinet, the current Minister of Health, Professor Karl Lauterbach, also unveiled the brand new digital health strategy as of just March this year, earlier this year. Germany passed its first e-health law back in 2015, including the introduction of the so-called telematics infrastructure. We call it here telematic infrastructure. And establishment even earlier, there was the agency established called Gematik, Gesellschaft für Telematikanwendungen der Gesundheitskarte, that serves as the German healthcare system's competence center for health IT and the electronic health card, EGK in German. This is considered one of Europe's largest IT projects, and Gematik, with this recent strategy that I just mentioned, is identified as the National Digital Health Agency. So this is the view of those 6 laws that were one after the other passed, adopted in 3 years between 2019 and 2021. Of importance to us, obviously we do not have time to go through each of them, but perhaps 2 most important were the Digital Care Act, the so-called Digitale Versorgungsgesetz, that provided framework for prescribable and reimbursable digital health apps, as well as established the foundations of nationwide electronic health records, the EPA, of which we'll briefly speak in a minute. And another law in 2020, passed in 2020, the so-called Krankenhauszukunftsgesetz, the Hospital Future Act, that envisaged investments of 4.3 billion euros on digitalizing hospitals in Germany. So in order to understand the situation with the digital transformation, digital maturity of hospitals, A big multi-stakeholder project was launched in May 2021, named Digital Radar or Digital Radar Krankenhaus. This group conducted very significant measurement of the health IT or digital health maturity of 1,624 hospitals. To remind us that there is about 1,800 hospitals in total. And the criteria for assessments were in 7 dimensions shown here on the slide. The average digital radar score identified was 33 out of 100. The best performance was in structures and systems, resilience, management and performance, and the lowest in information exchange, patient participation, and telehealth. This project attempted also to predict the MRAM maturity scores in participating hospitals, and they found out basically this picture that 69% of hospitals were graded as stage 0, and only a fistful of hospitals graded stage 4, 5, and no hospitals stage 6 and 7. The next, we will have a quick look at the rollout of the nationwide electronic health records. Sorry for the most typical, probably, typo that we all suffer from, which is in Germany, Elektronische Patientenakte, EPA. The rollout began in 2021. It is currently in version 2.5. It is available actually as opt-in right now to all those who are insured in the statutory insurance system. However, the uptake up to now has been about 1.2% of eligible population. As of November 20, 2023, there were 867,000 approximately out of 74 million statutory insured people. The situation with electronic prescription is also improving, going quite well this year. The nationwide rollout of electronic prescriptions began in on July 1st, 2023. There, up to now, there have been approximately 8 million electronic prescriptions redeemed. And to put it in context, there is a total of 760 million prescriptions filed each year in Germany. However, the ePrescription is becoming mandatory for all statutory health insurance physicians as of 1st January 2024. So there must be also quite some developments there. Another important application in Germany's digital health ecosystem is the so-called DiGAs, digitale Gesundheitsanwendungen, or digital health applications. Germany is considered one of the first, or the first nation, or among the first nations in Europe, and also globally one of the first to have enabled legislation for prescribable and reimbursable apps, including a fast-track procedure. As of now, there are 49 apps listed in the category of our analog of FDA, basically, the BfArM of the Federal Ministry of Health. Nonetheless, even here we are facing challenges with uptake. One recent study identified that, for example, only 1.5% of patients with migraine use the migraine app, which is available for prescription and reimbursement. With regard to secondary use of data, Germany is quite active in a number of international and EU-wide projects, including Health Data at EU Pilot, which, as far as I understand, will be spoken about later during this week. And there is the Health Data Lab, a special unit of the Federal Institute for Drugs and Medical Equipment, the BfArM that I mentioned earlier. There is a number of initiatives which are all also looking at wider availability of data for secondary use. I'm going to skip that one because of the lack of time. And finally, the upcoming developments. There are 2 major legislative packages that are discussed right now, as of actually a week ago. about 10 days ago in Bundestag, in the parliament. One is the Digital Act, so-called, the Gesetz zur Beschleunigung der Digitalisierung des Gesundheitswesens. Actually, the act to facilitate digitalization of the health system. And here, the proposal is to switch from from opt-in to opt-out with the electronic patient file. And it is planned or anticipated about 80% adoption of EPA by year 2025. Further measures here in this act will be the optimization of electronic prescription and digital medication acts, expansion of the use and integration in treatment of the digital health applications, removal of some telemedicine reimbursement limits, promoting easier access, and some others. And another law that is essentially currently in the same stage and should be adopted hopefully very soon is the Health Data Use Act that will aim to prepare Germany for the European or to synchronize, to harmonize Germany's ecosystem with the European health data space. In conclusion, Germany began its quest toward digital transformation of health nearly 20 years ago, but until recently lagged behind many countries in Europe. The telematics infrastructure here serves as a reliable and secure backbone for nationwide data exchange. The level of digitalization of healthcare providers, however, remained very low, with just a few around stage 3+ hospitals. Applications such as API, eRecept, and DiGA have recently been introduced, but uptake remains also low. There are prominent, albeit isolated and fragmented data projects, and most importantly, perhaps, and optimistically, there are significant efforts underway to generate data and prepare health system for the AI transformation. Thank you very much.